And thank you to UCLG Metropolis and UN Habitat for having me and inviting Rockefeller Foundation to this conversation. I know that our efforts as an institution are global, but in conversation with Jean-Francois, it sounds like we want to focus US. So I will talk about the United States and what we're seeing here in particular. And I think it's a really interesting dichotomy to be here and to see how much of a spotlight this pandemic has put on some of the key structural challenges that we have in the US and where we have really fallen short in terms of investing in data and public health, and how many of our communities here really lack the resources and technologies to actually track and mitigate and overcome this disease. And so for us, we've committed $50 million over the next 2 years to actually end this fight, not just in the US, but globally. And we're working with our communities that we serve in Asia, Africa, and the US to really support them, both immediately, but also set up the institutions that they need and the capacity that they need to get back to work and to build a better tomorrow. So our work on COVID, just to give you a bit of background, there's sort of 4 pillars that we've developed in response to what we've been hearing. So first is around preventing infections and future crises by increasing testing, access to equipment, and data-driven decision-making tools. The second pillar is ensuring that vulnerable communities around the world are more food secure, because as we're seeing, there's a huge hunger crisis emerging, and that feels like an urgent issue that is coming out of this, as well as the economic challenges that are associated. And then the third, which is very US specific, is focusing on low-wage workers in the United States. We've got millions and millions of families here who don't have access to benefits and stable livelihoods. And for us, that's a huge challenge that we want to address, because we want to improve their today and their future economic outlook. And then lastly, because we have offices around the world, we want to make sure our host communities in Bangkok, in Bellagio, Italy, Washington, D.C., Nairobi, Kenya, and New York City are protected. And so we're working with them and their local leaders to figure out how to do that. But specifically on the U.S., I mean, we've seen jobless claims here hit 22 million over the past 4 weeks, and we've basically erased all the gains we've ever had since the Great Recession. And for us, it's a scary thing to see how much our safety net has been exposed. And for about 40% of the U.S. population doesn't even have $400 to address this emergency, and we've got 1 in 5 kids going hungry. So in response to that, we just released something called the Rockefeller Foundation National Testing Strategy this Tuesday, because for us, we felt that the only safe way to get back to work was to test people. And I know we all agree here on this phone call that we've got to restart our economies. And so the only way to do this from our perspective is to do massive wide-scale testing. And what we're proposing for the US is 30 million tests per week achieved by the next 6 months. And we need to do that because this shutdown is costing us $350 million a month. And so the cost of rolling out tests will be far less. So there's 3 pillars to this. First is to launch this testing, and in terms of finance, one of the things that we're seeing is the breakdown in the supply chain in terms of scaling tests. And so what we're building out right now is a financial guarantee or a financial structure that will enable the supply chain to be addressed and these problems to be addressed, so that local communities can actually access tests and get them. We're also looking at trying to figure out how to support more laboratories running these tests. We've got a number of university labs who are needing support and resourcing to be able to stand up that testing. And we think that by increasing their lab capacity, we can get from 1 million to 3 million tests within the next 8 weeks or so. And then we're also building out a public-private testing technology accelerator, just because we know that both PCR tests are important, but we also need to make significant advances in serology testing in order to ensure we understand which populations are immune and which aren't. And so that would be a core part of getting our testing in capacity in the US in particular up to the level that we need to in order to safely open the economy. The second pillar, which I know people have talked about in different capacities, we've got a number of people who've come home and need jobs. And so for us, we're working with a couple of communities in the US to stand up a community healthcare corps and figure out how we can redeploy those people to serve public health departments and figure out how they can be trained for both careers in public health, but also to most immediately address the testing capacity that we need to scale. And then we're also working with some private sector enterprises in terms of figuring out how we build out the data systems in the US to allow for better tracking and prediction. And further on that, that is where we're also spending a lot of time trying to learn so that ultimately these solutions can be scaled. We would like to try to create a data commons and digital platform that aggregates both testing data and also data from the hospitals so we understand where those hotspots are and be able to protect our people better. And ultimately what we'd like to do is try this out in our current communities, but we're also hearing that from our African grantees as well as our colleagues in Asia, that it is critical that we roll this out elsewhere. So we're kind of using our local communities here as our guinea pigs to figure out how we do this well and create a strong blueprint that brings in finance, that brings in the communities and other private sector actors to be able to create a plan and a blueprint that we can roll out across the world and both stop this virus, but also enable us to protect our communities for the future. So thanks for having me.